student Koram Kuini, please start now. Stand here. Stand here. Okay. I should scroll it. Here, scroll it.
Our topic is about time management.
No, high volume. High volume.
It's not working. No, it's okay. It's okay.
I do well in school, so master managing my time efficiently, effectively. It takes all the fun out of life. Time management, I work better under pressure. No matter what I do, I won't have enough time. Increases productivity, reduces stress, improves self-esteem.
Grandfather, stop speaking.
Time, improves self-confidence, helps you reach your goals.
How much time until we are sitting together 24 hours in hostel speak? We are not respect your group mates.
Reduces stress, improves self-esteem, helps sexual balance of life, increases self-confidence, helps you reach your goals. Steps to manage your time. Set goals, set reasonable expectations, and remember that no one is perfect. Make a schedule. Revisit and revise your plan. Revisit your values. Knowing what is most valuable to you gives direction to your life. Your energy should be oriented first towards things and doing the values that are most important. Examine your values to help you make time management decisions. Where to start? Set goals. What is important? Make your goals specific and concrete. Don't be random. Set both long-term goals and short-term goals to support them. Set a deadline for your goals. Integrate your goals, school, personal and career. Realize that goals change, but know which goals to stick to. From goals, set priorities, what's important and what isn't. What order do things need to be done? Once you know what your priorities are, you need to plan out a schedule for the semester, the week and the day. Acknowledge the realities of college schedules. Planning may seem hard at first, but the more you do it, the easier and more natural it gets. Make a schedule. Set up your semester calendar. Block all important set time obligations. Block all class and lab times. Look at the syllabus for the semester. Note the weight of the activities. Highlight all exams and project due dates. Work backwards from exams and papers. Study time. Time for your assignment. Organizing your time. Set realistic goals. There are only 24 hours in a day. You spare time to review. Study at the same time each day. Make it a habit. Divide time, study time into manageable chunks. Leave extra time at the end. Tackle time wastage. Learn to recognize when you are wasting time. Decide what you need to do and can realistically do. Learn how to say no when you don't have time. Return calls at your convenience. The phone is a major time killer. Learn to say I can't talk right now. back to it. Wasting time is often linked to a lack of self-discipline. Ask yourself, do I really need to do this or not? Learn to say no. Avoid the temptation to socialize when you have scheduled work. If friends ask you to join them last minute, decline outright, but ask if you could get together later in the week. Socializing is important when you don't have other things to worry about. Studies have that you won't be tempted to chat, watch movies or YouTube, or use social utilities like Facebook. Texts are a major distraction. Revise and preview. Staying on top of things. Immediately not all changes. Exam, papers, due date revisions, meeting additions or cancellations, work schedule changes, upcoming visitors, etc. Preview the upcoming week, making any necessary adjustments. Review each day to see what might happen. Review time and energy management to make you more productive and reduce your stress level. The 3 steps set goals, make a schedule, revisit and revise your plan. Be tough with your time. Actively avoid procrastination and time waste. Learn to say no to distractions. Employ a variety of time management strategies to maximize your time. Relax and enjoy the extra time that you have discovered. Thank you.
Okay, and why independent work we need reading for our roadmates. First time we learning about how we can speak, and because after complete university maybe we are working in hospital, and every Monday we have meeting, and when meeting we need talking about our works, and we are giving our reports, and for example, last week we have 30 patients, 2 patients have this diagnosis, we are making this surgery, we have 10 patients this diagnosis and other. We need talking about this. And also maybe future time, and if you have any conference and medicine conference, and we are going in conference. In conference we need talking about your works, your jobs, yeah, your articles, and we need grow up over these skills. You understand? And don't be shy never. Because we are thinking about what's thinking all the people for me. Yeah, I'm telling for you secrets. All the people not thinking about you, always thinking about yourself. How I look like now, what thinking about for me. All people thinking yourself. You understand?
Yes.
And we are, if you come and maybe dirty clothes and shoes, and these people not looking your shoes and anything, because all people thinking about yourself, his self life, his self mentality. You understand?
Yes, ma'am.
Okay, thank you for all. And reading more energies and more time all behaviors in our family, talking about what we think about other people, what we think about my relatives, my roommates, yeah, my village mates who is living here. This is not important. You understand? Important what do you think about you, what you feeling now, and about every time every time think about yourself. What important for you? How you feeling today? Yeah, how you look like today? And if you're happy, you can to become other people happy. You understand?
Yes, ma'am.
Every time grow up yourself. Not think about I need help my family, I need money, my parents and other. First time, give yourself. If you grow up and after you can help other people, you understand? If you sitting, you helping all people, and after you not have any money, any mental power, and after you die, how you can help? You understand? Every time we need thinking about ourselves. And this is first rules for future doctors, because for helping for other people we need powers. Every time think about yourself, what you're eating, how you're sleeping, which people you have near. Yeah? If you're telling near people for you bad words, these people need deleting in your life. Yeah? And because we need only good power energies. Next, how much? Okay. This is 231, and you're telling, and after I'm putting your marks. I'm young time, I'm also, this is my mistakes, every time I'm thinking about all the people not important. More time also, all parents or relatives also have his goals for us. And okay, time management, we accomplished. Introduction. This student's name.
تبدأ كلام كده سلايد
Which student?
فلاش دخل دفعت سهل راجل ليه؟ مقصد تایمی سمینار ما فعلا نیست، فعلا ما لکچر داریم، ما تایم دوم که سمینار داریم. خب
Ready, Danish, which group? This Manoj Nagar is absent. All students, this comes here. Your roll number? 231. Okay, please. She's PPT task, introduction to the medical profession, its subject, status, and range of problems, the concept of the profession of a doctor.
Start. So, good morning everyone. Let's start with the medicine. Medicine is the science and practice of caring for a patient, managing the diagnosis, prognosis, prevention, treatment, palliation of their injury or disease, and promoting their health. What skills are needed to become a doctor? Strong problem-solving skills, effective decision-making skills, leadership skills, communication skills. Skills of a doctor: organizational skills, interpersonal skills, technical, leadership, fundamental knowledge, and communication. The role of the doctors in society: guardians of health and well-being, providing medical care, advocates for their patients, healers of emotional and psychological distress. Doctors contribute to society through medical research, innovation, and public health initiatives. What does a doctor do? Listening carefully to patients to gather information regarding symptoms, performing diagnosis to determine the root problem, reading and interpreting laboratory results, prescribing medications and administering treatments, ordering and performing procedures as needed. Advantages of the medical profession. High earning potential, job security, personal satisfaction, and variety of specializations.
What is mean high earning potential?
So, high earning potential means doctors typically they will earn high salaries, and especially if they got any specialization, they can expect even more. And job security, the demand for healthcare professionals consistently high. Personal satisfaction. Many doctors find great satisfaction in helping others and making positive impact on people's life. Variety of specializations. There are many different specializations within the medical field, and doctors can choose to focus on an area that aligns with their interests and skills. Disadvantages of the medical profession. Long working hours. Many doctors work long hours, including evenings and weekends, which can be demanding on their personal and family life. Stressful work environment. The medical field is fast-paced and high pressure, which can be stressful for some doctors. Malpractice lawsuits. Doctors can take high risk of malpractice lawsuits if they make mistakes or their treatment doesn't go as planned. High educational and training costs. Becoming a doctor is a long and expensive process. Forensic medicine. Forensic medicine is a broad term used to describe a group of medical specialties which deal with the examination and diagnosis of individuals who have been injured by or who have died because of external or unnatural causes such as poisoning, assault, suicide, and other forms of violence, and applying findings to them. Pathologist. A pathologist is a medical healthcare provider who examines bodies and body tissues. He or she is also responsible for performing lab tests. A pathologist helps other healthcare providers reach diagnosis and is an important member of the treatment plan.
You know, this pathologist doctor and putting conclusion diagnosis. Yeah, what is mean? And we have morphological diagnosis. We have micromorphological, micromorphological, macromorphological. This means when we are looking with our eyes. If you one woman coming here and every day is beating husband and coming with what? Hematomes, injury, trauma, yeah? We can look this with our eyes. This is macromorphological, we are looking and writing. And we have micromorphological, where we can looking only on the microscope. And this pathologist doctor and giving conclusion diagnosis. And if if you want people dying and we are finding one body and we need now how this patient died, yeah? Maybe he's after aspiration with water, maybe with trauma, yeah, and the other. And these doctors checking, making checkup under microscope cells, and giving for us conclusion diagnosis. And this pathologist doctor and we are say also patho-anatomical doctor can making autopsy. And this doctor not only making autopsy. One doctor making autopsy, but pathologist doctor. One doctor can, if he's not like it working autopsy yet, and can working with microscope and checking all tissues. Yeah, maybe under any victims, yeah, after rape, can checking and sperms, any liquids, any injuries, checking under microscope. And also this doctor, if you after any surgery, we have any tissues, biopsy, yeah, tumors, and checking these tumors, giving conclusion diagnosis, which type of these tumors, yeah, which type of these cells. This is cancers, and which type of tumors can giving or conclusion diagnosis. Next.
Types of medical specialties. Anesthesiologists. Anesthesiologists are trained to manage patient pain and vital signs during surgery. They also often manage medical emergencies in the hospital, such as cardiac
anesthesiologist doctor. This is very more important for surgery, because if you don't have good anesthesia, your surgery not to become. Yeah.
Yes.
And anesthesiologist doctor where can work in stomatology hospital, in big hospital, where you can have small operation and big operation. All places need anesthesiologist doctor.
Cardiologist. Cardiologists focus on treatment of the heart and its blood vessels. This can improve the management of heart failure, cardiovascular disease, and post-operative care.
Okay, which cardiovascular disease you know?
Myocardial
infarction. Next. Angina pectoris.
Heart attack.
Heart attack. Cardiac arrest, heart attack is synonyms. Do you have also disease? Aortic valve insufficiency, mitral valve insufficiency, yes, tricuspid valve insufficiency, myocarditis, and congenital heart disease, yeah, and all these cardiovascular disease, learning our cardiologist doctor. And also, we have cardiac surgeries. This is also. Cardiologist doctor can work in polyclinic and also can work in hospital. That on care, yeah, for care, and also can giving a treatment for doctors. And also after operation, and this cardiologist doctor can care this patient. Yeah. Guys.
Gastroenterology. Gastroenterology is a branch of medicine that focuses on the digestive tract and the gallbladder, liver, bile ducts, and pancreas. A gastroenterologist is a doctor that deals in those fields and is also referred to as GI specialist or GI doctor.
Okay, tell about which disease learning this doctor. Start. Stomach ulcers and the
IBS.
and the Helicobacter pylori. This is reason gastritis ulcers. Yeah, we have duodenum ulcers. Yeah, intestine organ ulcers and the also which gallbladder disease you know? Pancreatitis and other. Okay. For first year students, good. Next.
Neurosurgeons. Neurosurgeons are involved in preventing, diagnosing, and treating disorders of the brain, spine, and nerves. Neurosurgery is a medical specialty concerned with the diagnosis and treatment of patients with injury or diseases or disorders of the brain, spinal cord, spinal column, and peripheral nerves within all the parts of the body.
You know, neurosurgery, this specialization very heavy and very high salary. Very high salary, and that this is very heavy. You need learning 5 years bachelor medicine. Now I don't know how much internship, but my time we need learn 2 years internship. After need learning 4 years residency neurosurgery. And you know, for to become neurosurgery doctor, you need 11 years. Yeah, 11 years you need. And after complete, you only starting. You have salary, and before this you need living only about for your. If you have your scholarship, maybe for scholarship money. One time, this is very heavy majors in medicine. You need every time, maybe your, if you have operation surgery, you need standing for 6, 8, 12 hours and working. And also need very good eyes. Okay, next.
Oncologist. Oncology is the study of cancer. An oncologist is a doctor who treats cancer and provides medical care for a person diagnosed with cancer. Based on the basis, the field of oncology is divided into 3 subdivisions: medical oncology, radiation oncology, and surgical oncology.
You know, oncologist doctor, this is also stress. You're looking more time how dying patient. And very stressful. And we have where kids oncology disease if you work in the hospital, also very heavy. And in oncologist doctor, we have structure, medical oncologist, we have breast, mammologist doctor, yeah? Mammologist and oncologist, only learning about and the breast cancer. Radiation oncology, this doctor making examination with radiology and also giving treatment with radiation therapy. And we have surgical oncology. This is making surgery for oncology disease. Next.
Pediatricians. Pediatricians are medical specialists who diagnose, treat, and provide medical care for babies, children, and teenagers. They treat illnesses and will check your child's physical, mental, and behavioral development.
Pediatrician doctor also heavy majors because your patient not can speak, yeah, if you this is small babies, and you need putting diagnosis. And if you will have adult people, stop speak. What? If you will have adult people can speak, yeah, and telling we are asked what happened with you, where you have pain, and say I have blah this pain, and we understand and where we need examining, yeah. And if you have newborns, 20 days, yeah, after birth, and this newborns not speaking, and but we need find which diseases patient have. And you know, for these majors, very important communication. If you introverts, not go for this major because you need speaking with parents, with relatives, these patients need very more good communication skills.
Radiologists. Radiologists are medical doctors that specialize in diagnosing and treating injuries and diseases using medical imaging, radiology procedures, exams or tests such as X-rays, CT scans, MRI, nuclear medicine, positron emission tomography, PET and ultrasound.
Radiologist doctor in now Kazakhstan, very more doctors want to become radiologist doctor because this is very good majors for infrared. You're not looking any patient, and you have nurse, and this nurse making and working with apparatus, taking photo. You only come and you looking in computer paint these organs. You need writing conclusion which diagnosis this patient have. And for this doctor to become, you need stop, speak, la. And you need learning 11, 12 years. 5 years bachelor, 2 years internship, maybe now 1 year internship.
Yes.
Every time changing education, I don't understand what happened with this. Okay, 5 years bachelor, 1 year internship, and 4 years radiologist. And one university, maybe in India 2 years, I don't know. And 1 year, and you need checking university, how much radiologist. And this radiologist doctor, if you have this major, if you have good communication with any hospital boss, you can work more place. You sitting in computer and writing conclusion. You know you can communications with any patient, yeah. And but this also you need more knowledge because you need putting true diagnosis. If you not putting true diagnosis, maybe this patient have complications, yeah. And also these doctors, if you know, if you want working with people, you can also giving treatment for oncology patient, radiotherapy, I say radiation therapy. What is mean? We have positron emission tomography. This we are giving contrast. We are inject, and after we are taking photo, and these apparatus can looking cancer cells, every cancer cell, And radiologist doctor can giving for these cancer cells with radiation therapy and giving treatment. You understand?
Yes.
Next.
Obstetrician gynecologist. Obstetrics and gynecology are specialty that comprises the two subspecialties of obstetrics covering pregnancy, childbirth, and the postpartum period, and gynecology covering the health of the female reproductive system, vagina, uterus, ovaries, and breast. The specialization is an important part of care for women's health.
Obstetrician gynecologist, very heavy major. If you go to become this doctor, you need work. You every time working with two life, mothers and with baby's life. This is very heavy. If you use powers, if you have any more powers, then you can work in night, in day, and you can go this specialization.
Ophthalmologists. Ophthalmologists are the only practitioners medically trained to diagnose and treat all eye and visual problems, including vision services, and provide treatment and prevention of medical disorders of the eye, including
You know, ophthalmologists, very good majors, and because what we are all people wear city with phone, yeah, decreasing his vision, and then now if you are ophthalmologist, this is very good majors, and you can also sitting in polyclinic, in hospital, you can making surgery, and also you can work in private clinic, because more private clinic need ophthalmologist doctor.
Pulmonologist is a physician who specializes in the respiratory system, from the windpipe to the lungs. If your complaint involves the lungs or any part of the respiratory system, a pulmonologist is a doctor you want to solve it.
Which disease learning this doctor? Tell me, students. Huh? Respiratory system disease, which disease?
Asthma.
Bronchitis. Tuberculosis is T secretion doctor. T secretion. Pneumonia.
Asthma.
COPD, asthma, epilepticus, and the other.
Medical ethics. Medical ethics is an applied branch of ethics which analyzes the practice of clinical medicine and related scientific research. Medical ethics is based on a set of values that professionals can refer to in the case of any confusion or conflict.
You know, we need medical ethics for keeping patient secrets. We are not need conflicts and all that. If your patient coming, yeah, maybe you want trauma for you and other. This time not need sitting. Call police. You understand? And we are telling we need communication and other. But if you looking and this is not good, we need calling police. This is not good because we have very more situation, trauma, medical workers. You understand? Because medical workers need, I'm doctor, I'm nurse, okay, and okay, we are not telling anything, la la la. After, maybe you have injuries and other.
There are 4 pillars of medical ethics. They are beneficence, doing good, non-maleficence, to do no harm, autonomy, giving the patient the freedom to choose clinic where they are living, justice, ensuring fairness.
Okay, thank you for all. Okay, please. Okay, students, tell me which knowledge, give me feedback, which knowledge today you knowing for our students' independent work.
It was about time management and also professional like cardiologists, pathologists.
This is for you interesting.
Yeah.
Okay, who is one telling? You?
The first one is about the value of time that we should manage and control our time, and the second is about the introduce the medical field and about the different branches of medicine. It was so great.
Okay, you?
How we can manage time, how we can say no to the things which we don't want to, and we got to learn so much about the medical field, the types of specializations, and the medical ethics and all.
Okay, what is mean ophthalmologist? Yeah. Which organs disease learning? Okay, next. Okay. Ophthalmologist. Eyes, yeah? Okay, next. Neurosurgery. Who is this neurosurgery doctor? Nerves? Brain. Okay. Next. Cardiologist. Who is
About
it?
heart, deals with heart and disease.
Yeah, heart attack and all the disease. Okay, next. Gynecologist.
It's about babies, how to treat babies, how to treat people while pregnancy and deliveries. Yeah.
Okay.